So as Shruti was mentioning, a lot of my work is in engineering theory, mathematical engineering theory, and over the last several months, we've been looking at a variety of problems in relation to the COVID pandemic. And I thought I'd talk about some of those, and also the work of several other of my colleagues, just to give you a sense of some of the kinds of things that we feel might be important dealing with this pandemic, but also in preparation for any future pandemics and future waves. Here in the United States, we are seeing increased infection rates, kind of a third wave of infection. I know in India things have tamped down a little bit, but we're kind of working hard to see what we can do. So let me share my screen. And before I do that, let's see what's going on. Okay, yeah, so as I was mentioning, I'll focus on kind of mathematical engineering theory approaches, which is a little bit different than some things that when a lot of people think about engineering. Let me briefly show you a video of one of our students, Mihir Vardhan. He's a freshman in my department, and he's been working on robotics for COVID disinfection techniques based on UV light. So let me show you that briefly, and then I'll kind of try to see how that's related to engineering theory. So hopefully you can hear this.
My name is Mihir Vardhan. I'm studying at the University of Illinois. I'm an ECE major and I'm a freshman this year. India went into a 3-week-long full lockdown in the beginning of the pandemic. And my neighborhood had to start shutting down stuff like Amazon deliveries, food deliveries. And that's when someone in my neighborhood pointed me toward UVC sanitization. Using UVC light with the right exposure, we can actually disinfect any packages. And some of the technicians in my neighborhood helped me build a big disinfection chamber that later became the Terminator Mega. The Prime Minister's office ordered a Terminator Mega. The army got a few of them. Later on, people kind of started asking me, this thing is way too big for my house. It doesn't even fit to the front door of my house. So we then made the Terminator Mini, which is for homes. Postal services are starting to use boxes like that. More and more people either kept saying, I want a machine smaller, or I want a machine bigger, or can we sanitize a package this much bigger, or can we even sanitize an entire room? The way UVC disinfection works is that you can't just...
Right, so this was this kind of robotic technology that Mihir built. And I think this is the kind of engineering that's familiar to a lot of you. Some of the projects that I've seen throughout the India Science Festival are about building technologies, and this is really powerful. And in many ways, this is the style of engineering that seems to capture the popular imagination. If you look at children's books that are popular here in the US, like Rosie Revere Engineer, or movies in India like Three Idiots, it's very much about building technologies and deploying them in the world. And of course, that's really powerful. And there's also this growing idea of Jugaad innovation, trying to develop low cost and easy to deploy technologies. Just as an example of that, over the summer, as the pandemic was really getting going, many of my colleagues at the University of Illinois built this Illinois rapid ventilator system. And this was low cost, easy to manufacture, and this helped address the ventilator shortage in the United States and elsewhere. And this was using a lot of ideas from mechanical engineering and things like that. Likewise, a lot of my colleagues also looked into other problems with, for example, with masks. My colleague Helen Nguyen, she showed how you can disinfect K95 masks using just a rice cooker. In fact, you can cook masks in rice cookers, and that's incredibly effective at disinfecting them. So then you can reuse them. And my colleague Tahir Saif showed that using T-shirts as a fabric for making masks is incredibly effective, much more so than other kinds of fabric. And so these kinds of frugal innovation or jugaad innovation were really important as the pandemic was really starting, because we needed technologies right away. Likewise with the disinfecting technologies that we hear about. But what I want to try to say in this talk is that as we proceed and we have a little bit more time to think about how to approach pandemic control, what we need are a good set of limit theorems. In fact, we need to develop some theory, mathematical theory, and that will be super important as we go along to try to understand what is possible and what is impossible as we develop engineering technologies. And the interesting thing with these kinds of mathematical techniques is that they require defining a mathematical system, if making some assumptions about how the world works, and then proving mathematical theorems and driving optimal algorithms out of those deductive systems. And just to give you some background into how engineering theory works, there's a lot of examples of these limit theorems. Sadie Carnot established the fundamental limits on the efficiency of engines in thermodynamics, which you might have seen in some of your classes. And the basic idea is that there's a maximum efficiency with which engines can work. It's impossible to make engines that are more efficient than that. And this was inspirational for the diesel engine. In fact, diesel took some ideas from Carnot and achieved a pretty high efficiency. And also this idea that raising the temperature can increase efficiency came out of Carnot's work. Another nice example of this is Claude Shannon. He established the fundamental limits of communication in the presence of noise. What he showed was that there's a capacity. If you try to signal at information rates greater than the channel capacity of a noisy communication channel, it is impossible. But it is possible to do so right to those limits. And as another example, Sertaj Karaman and Emilio Frizzoli established a fundamental speed limit of flight in force without crashing. And so we can figure out how quickly you can fly, and you can go right up to that speed limit. But if you try to go any faster, you'll crash infinitely often. And in fact, Sertaj was my roommate in graduate school when he was working on this. So I got to see this theory developed in person. Some of my own work also establishes these kinds of fundamental limits. Some work I've done recently is looking at creativity, trying to ask what are the fundamental limits of how creative any system can be, whether a human or a machine or some hybrid, and how close are we as humans to those fundamental limits of creativity. And the nice thing with fundamental limits is that it tells us the best that we can do, no matter how clever the engineer is. But then it also pushes us to take the example of Shannon capacity over. So Shannon's theory came out in 1948, just after the war. And it pushed us to develop optimal communication techniques. Over the last 60, 70 years, people were actually able to achieve pretty much right onto the Shannon limit. And this really was a guiding ideal that helped technology progress. And not only did it help us advance towards the theoretical limits, it also told us when to stop. Once we know that we're within 0.0045 dB of the Shannon limit, perhaps we don't need to work any harder. That's as best as we can do. So broadly speaking, these fundamental limit theorems establish which resources and performance criteria are most important and which ones are largely unimportant. They demarcate what is possible from what is impossible in engineering design, and also provide inspiration for practical optimal designs. Third, they define fundamental benchmarks that allow us to evaluate new engineering designs on an absolute scale, so we can know how well we're doing as compared to what's the absolute best that we could do, rather than only comparing to previous technologies. And as I was mentioning, it also pushes people to build technologies that approach or achieve these absolute limits. And so that's why in a lot of engineering fields, there's this desire for limit theorems, and that helps us know what to do and how to get there. And as I was mentioning, these mathematical limit theorems require us to have some sort of abstraction. Frequently in communication, the message is related in some sense to physical or conceptual entities. But when Claude Shannon was proving his limit theorems for information theory, he said that the semantic aspects of communication are irrelevant to the engineering problem. So he defined communication to be defined by this block diagram and said, this is all that I can do. Likewise, Carnot's know-how was not really in building a machine, but rather a diagram. In a sense, it allows one to move from one engine to any other, and indeed to any non-existent engine simply drawn on paper. And so it allows an abstraction, and then one can prove limit theorems. And that's how mathematical engineering theory works. We define a closed deductive system, and then we can prove theorems within that. And then that inspires engineering design, as I was discussing. And there's a variety of branches of engineering theory, like this signal processing, information theory, control theory, queuing, learning, data science in certain respects, artificial intelligence in certain respects. And we can use a lot of these ideas to address mathematical and data problems that are emerging in COVID control. So there's problems in public health surveillance. There's problems in contact tracing. There's problems in efficient use of physical testing resources. There's questions of how to model and predict and control the spread of disease. And one can even use some of these ideas to design molecules, whether it's for better sensors or for even antibodies and vaccinations. So I'll discuss a few of these ideas, and I won't go into too much detail, but I'm happy to go into detail further as we get into the question and answer part. So one question one might ask is, how do we know if the pandemic is changing in its course, that we're having a new wave? And my colleagues, Liang and Virabali, they've developed some recent algorithms that they call quickest change detection. And so one can look at the statistical properties of the dynamics of cases in, for example, different counties in the United States. And they can say, when is there just a spurious peak and when is there actually an increase? And this doesn't require any statistical knowledge, and it can work in any setting. And so they've been able to demonstrate that this is very, very effective to know when a wave is coming in advance, not when it's already on top of us. Then one can think about imposing control strategies. One can wonder whether natural social distancing is enough. And my student Doug Hill and my former postdoc Abhishek from IIT Madras, what they've been looking at is, together with myself, is when is natural social distancing enough to tamp down epidemic spread? And what we show is that, in fact, there's a sharp threshold. So people in general will adopt more stringent precautions when there's a larger number of active cases. We'll have greater social distancing, better hygiene, and so on. And as long as the epidemic curing rate is below a given threshold, the mean time for epidemic die out will be infinite, which is to say it'll never die out. On the other hand, if the curing rate for the infection is above a given threshold that we can compute, the epidemic will die out very, very quickly. And we establish a very precise characterization of this. And so combining this with the quickest change detection, in a sense, we can figure out when natural control strategies like hygiene and social distancing, just naturally as people do, is sufficient. On the other hand, perhaps one needs to impose a governmental policy control. And so then it's an explicit control strategy. And one can ask which kinds of control strategies are optimal. If we want to keep the number of patients of COVID below a certain threshold, for example, the number of beds that we have in a hospital. So we can analyze existing control strategies like on and off, but then we can derive optimal control strategies based on the reproduction number of the epidemic. And in particular, we can ask what happens when the actuation, when the ability to actually impose policies is limited to a finite set of possibilities. Perhaps we could only close schools or only close retail shops, or perhaps we can impose a full lockdown of all activity. So there's only, say, 3 or 4 possible control activities. Then this control strategy that uses very fine gradations is not possible. And so then we can ask, under this constraint on actuation channels, how well can we do? And what are the fundamental limits? And further, what if there's noise in the sensing, like I showed with the quick exchange detection? How does that impact the design of the controller? So all of these things can help policymakers really figure out what to do. Okay, so that's this idea of spread prediction and control. But one of the keys that goes into this is sensing. And one of the difficulties we've been facing is a shortage of testing supplies. And there's been this idea around since World War II, again, from the 1940s, that one can pool tests in order to reduce the physical costs. So we can mix together the saliva or nasal samples of several patients and then test them all together. And if no one is sick, then the test will come out negative. And if at least one person is sick, then the test will come out positive. And if there's a positive test, then we can retest individually. And if there's a sparse number of people that have the disease, then this can be much, much more efficient than individual testing. It'll use many fewer supplies. And traditionally, it was assumed that infection state was independent among people, but we can actually now take advantage of the social network structure that we know other symptoms, wastewater surveillance data, and a variety of other ideas and sensor data and so on, side information, and actually use all of that data together with the testing to design new pooling strategies. And further, we can show that the performance is close to the information theoretic limits. So it's the techniques we've been coming up with, either manually or using machine learning to help us design things, is as close to the information theoretic limits as possible. And further, we can even consider queuing considerations because test results aren't that useful if they're delayed a lot. And so if we can think about how to make sure there's timely results, perhaps we trade that off with error probability. One very nice technique for this pooling has been developed at IIT Bombay and by Manoj Gopalakrishnan. And there's a company called Moria that's led by Shashi Borade that's helping to push this forward as well. And tapestry pooling is basically a version of group testing, but using slightly different mathematical ideas. And again, the idea is not to necessarily do it sequentially like I was describing, but to actually pool samples of patients in different groups and then do this kind of decoding. In fact, they're doing quite well. It's been approved for use in India, and they've gone through clinical trials and all. So I think it's going to be deployed pretty soon. So that's testing. But then another question, mathematical question that arises is contact tracing. Even though we're doing pretty well in terms of testing, there will be noisy test results. There will be missing data. And moreover, if we look at how the testing has actually happened. It's been, I'm sorry, how the spreading has happened. It's largely been through overlapping social bubbles rather than person to person individually. And a lot of people have been trying to do contact tracing at a person to person level, but what we try to argue is that it's better to actually model things as what's called a hypergraph, kind of group-wise interaction among people. And that allows us to actually find computationally feasible approaches for identifying the infection source of a spreading process of an infection, of an epidemic, as a super spreader event. And once we do that, we can then go back and do forward tracing again. And so backward tracing to determine the source of infections and then forward tracing outward. And we've been able to prove that this is also optimal, the technique we've developed. And further, there's been some deployment of some of these techniques in Geneva and Switzerland for their contact tracing, and we're talking to some other folks about how to do that. Another direction that one can think about for using mathematical and computational techniques in COVID is actually to design proteins and other similar molecules. Some work that's been done at Salesforce Research, where I was last year when the pandemic started, has been looking at generative artificial intelligence models for the design of proteins. And one can specify a variety of input parameters and then design new proteins that have never been developed before. And this can be done using the kind of the molecular structure of proteins. And this, although vaccines have now been developed using mRNA techniques, this would be kind of an alternative idea that one can explore to design proteins using artificial intelligence and deep learning to do so. Another question one can ask in molecule design is what's called DNA origami. This is work that my colleague at Illinois, Xing Wang, has been working on over the years. And the idea is, can we design DNA molecules that have a certain geometry so that they lock onto virus molecules? Here it's shown for dengue fever. So this DNA origami molecule was designed so it attaches to the dengue fever molecule, and then it lights up, and so it becomes a much better sensor, easier to sense. And we're working on something similar for COVID, for the coronavirus. And the interesting thing is here, it's fairly difficult to do this by hand, this kind of design. But one can ask, and can one develop computational geometry and computational creativity techniques to help design these DNA origami molecules, and that's something we've been thinking. Okay, finally, I wanted to just talk briefly about some purely data-driven things that are a little bit separate from engineering theory, which is how social determinants and social capital impact seem to impact COVID growth rates. Social capital has been associated with a lot of health questions like mortality, obesity, diabetes, and so on. But the relationship of social capital to the spread of infectious disease has been lacking. Social capital is this idea that communities have certain strength by the neighborliness of people, by their belief in institutions, by their participation in social groups, and so on. And so one can also ask, so is social capital leading to the increase in infectious disease or the decrease? And furthermore, one can ask, can social capital help with adherence to social distancing protocols? And so we did some studies in the early days of the pandemic, and what we saw was that, in fact, COVID growth rate decreased with social capital in the U.S. states, as well as in specific counties within the United States. And so there was a fairly reasonable association between stronger social capital and lower growth rate of COVID. Moreover, one could see that social distancing increased with social capital, and so there was greater adherence to social distancing requirements in counties that had greater social capital. Okay, so this suggested that, in fact, having strong communities is a good thing, both for preventing the spread of disease as well as increasing the adherence to social distancing. Okay, and those finally, given the importance of social capital, there's been a growing concern about loneliness in communities because of social distancing. And so something else I've been working on with my student Heisi is, can we develop technologies that can help us be creative with other people, like compose music with other people remotely. And so we're pretty excited about this as a way to increase well-being even when we're socially distanced. So, so those are some of the ideas that we've been playing around with and developing some mathematical ideas and results and algorithms and technologies to really try to encourage better results in pandemics, both from a disease spread perspective, as well as a molecule design perspective, as well as a social capital and social well-being perspective. So let me stop there, and I'm happy to take questions. And I saw there were quite a few coming in, so I'm happy to take those.
Thank you so much, Professor, for a fantastic talk. It was really exciting to see how tools from maths and statistics can be applied in such real world scenarios. I'm going to ask you questions from the chat. We've been getting questions from different medias that we've been live on, including YouTube and Facebook Live.
Yeah,
And
sounds
our
good.
first question wants to ask, can we produce any tool to get signals regarding zoonotic diseases or other contagious diseases, perhaps before they blow up into a full-blown pandemic?
Yeah, I think that's a good question. As people might know, a lot of diseases come from other animals into the human population. They're called zoonotic diseases. And in fact, it's thought that a lot of animals serve as reservoirs for these unusual diseases. And so, in fact, my brother, Kush Varshney from IBM Research, he had a paper some years ago on trying to predict which organisms might be the most likely to transmit diseases to humans. And so they used kind of a machine learning approach that was quite powerful. So I think there are some ideas, but it also requires a lot of public health surveillance.
I see. It's encouraging that there are at least some directions that we can take to predict these before we reach this stage again. Another question that we have is the same models that you have been using in the United States. Do you think they work in other countries, perhaps like India also?
Yeah, that's the nice thing with this kind of abstraction from that we take in the engineering theory approach, which is that it's a fairly abstract model, and we develop algorithms that are pretty much agnostic to the specifics of the setting. So they'll apply to anywhere, whether it's the United States or India or Europe or anywhere. So that's exactly right. Pretty powerful techniques.
That's fascinating to know. And on that same note, our audience members want to know a little bit more from you about the forward versus backward tracing techniques, and perhaps about the hypergraph technique that you mentioned.
Sure. The traditional approach to contact tracing is you take someone who's infected currently and you see who are their contacts and you go forward and try to figure out who might have become infected. But this ends up being difficult because it's hard to remember everyone that you interacted with and so on. And moreover, there's a lot of the spreading with COVID happened because of these super spreading events. So it's in schools and so on, concerts or protests or whatever it is. And furthermore, there's been kind of these social bubbles. And so people have been interacting in these small groups that are partially overlapping. So you might have your family that you interact with and also your business partners. So what we were suggesting is that it'll be much more effective if we first do backward tracing. We find out what was the original source of an infection in a community, what was the super spreader event that started things, and then try to find out everyone who was at that super spreader event, and then do the tracing kind of social bubble by social bubble, so family by family or company by company, rather than trying to do it at an individual level. And this is also much more connected to the control or quarantine strategies one would use anyway. One would end up quarantining a whole family anyway. And so this can be more effective and more tied to the strategies one would use downstream.
And how is this different from the hypergraph theory that you talked about?
Yeah, so the fact that we're looking at things at a group-wise level, so bubble to bubble, that's why the hypergraph model applies rather than a simple graph model, which is a person-to-person kind of model. And so we
I
think
see.
of people as members of these hyper edges. They can have membership in several groups, and so that's why this hypergraph model is appropriate.
Right. And do you think this could lead to potentially a large number of positives, which may not be indicative of the actual infection rate?
So one of the primary purpose, as far as I'm concerned, of contact tracing is to use it for quarantine strategies rather than large-scale surveillance. If one wanted to do large-scale surveillance, then one could use the group testing ideas that I mentioned elsewhere. So the purpose is really to get the pandemic under control. And one shouldn't really be concerned about the testing numbers. In fact, contact tracing isn't really meant to give a prevalence number. It's meant to kind of characterize where the disease might have spread. And then one can do testing within those groups that one has identified.
I see. Thank you for clarifying that for our audience. We have another question which says, is an increase in biological technologies actually leading to a production of new viruses?
It's a good question. Not that I'm aware of, but this is also not my expertise. So I'll defer to other people who might know more about this.
Fair enough. Members of our audience are also very interested to know about your opinions on AI ethics.
Sure.
That you've been
So
looking into.
a lot of my research work these days is in this area. And there's a lot of aspects of AI ethics that one can think about. So there's a lot of emerging ethical principles like beneficence, non-maleficence, justice, respect for human autonomy. They're largely derived from ethical frameworks that have been used in other domains like biomedical ethics. And I think it's important to have a lot of these ethical principles in mind as one starts to develop and deploy technologies out into the world. In particular, AI safety is something that I'm specifically concerned with. In addition to my faculty position, I'm also the chief scientist of a startup called NCERIS, which looks at wastewater and AI. And so one of the things we've been looking at from an ethics perspective is how to ensure that the AI that's helping optimize wastewater treatment plants is being safe. Like you don't want to accidentally cause a cholera epidemic by discharging dirty water or environmental damage or anything like that. And so we've been developing algorithmic techniques to ensure safety in the face of uncertainty. Likewise, when I was at Salesforce last year, I was looking at safety of large-scale language models. And again, there's some concern that they might be used for misinformation and other such bad applications, some societally deleterious applications. And so again, we were looking at this question of safety and how to ensure that. So I think there's a lot of questions that are still open and worth thinking about. And even the questions of ethical frameworks that we should think through are largely open. The ethical framework I was just describing with the four principles of justice, beneficence, non-maleficence, and respect for human autonomy is largely derived from a combination of deontology and so on, and some other ideas. But there's other ethical frameworks as well. For example, in India, there's a lot of kind of ethical frameworks that one can draw on. So I think there's a lot of questions that one can think about, and one should think about as one goes forward.
I see. And I think it's also important that we do, because this seems to be the direction where we are headed for in the future. And on that same topic, our audience is asking if there are resources that they could use to perhaps start reading on AI ethics, as well as your work on creative capacity.
Yeah,
Do you have any suggestions?
Yeah, so I've written some papers on AI ethics that are available on my group's website, but there's a lot of emerging work. There's two conferences that really have very nice papers for those who want to read at the academic research level. One is called the Artificial Intelligence Ethics and Society Conference, AIES, and the other is called FACT, Fairness, Accountability, and Transparency, FACCT. That's an ACM conference. And so both of those conferences have really nice papers that are at the cutting edge. And a lot of organizations ranging from governments like the government of Australia to international organizations like the IEEE have developed frameworks for thinking about AI ethics. And so that's a more practical kind of way of thinking about ethics that one can look at, and so on. I think there's even starting to be some books that are coming out on trustworthy AI and AI ethics. So a lot of things that one can look at. In terms of the mathematical limits of creativity, so I wrote a paper last year, I guess now 2 years ago in 2019, which was titled, I think, Mathematical Limit Theorems of Creativity. So I'm happy to share that with anyone. Just email me and I can send you the paper.
Our team will ensure that a list of these resources that you've just mentioned are collated and put out on our social media for the audience that would like to look at them. There's another question that's been coming up, and it's a question that a lot of people have been asking these days. There's been a lot of modeling going on which predicts various things. And a lot of it happened in the times when you didn't have a lot of data, in the early days of the pandemic. And our audience would like to know whether that's actually been helpful in controlling the pandemic and whether these statistics have actually yielded real world policy decisions.
Yeah, so in fact, just yesterday, there was a paper that my friend Dashan Wang from Northwestern University had in Science magazine, which was looking at how scientific research for COVID and policy responses for COVID and interacted. And what their paper yesterday showed was that, in fact, there has been a strong interaction between policy makers and scientists for this pandemic. It's been uneven in certain ways, but I mean, surprisingly, there has been a lot of scientific work that has been incorporated into policy design. Coming back to whether like data-driven versus kind of model-driven approaches have been more effective, I think as things have progressed, like in some way, like one can take a Bayesian view. So there's this idea in probability and statistics called the Bayes theorem that you can have prior beliefs that are coming from models, and then you can also have data or measurements that also support your inferences. And I think a lot of the earlier work was very model-based, kind of based on prior knowledge of the physics of disease spreading. And it's become much more data-driven more recently, using econometric techniques and others. I think the combination has started to be quite powerful. As I was mentioning, I think the real power is less in kind of just prediction. I think the more interesting and the more powerful approach or utility of some of these techniques is in control strategy design. So trying to bring together prediction and sensing to inform control. And I think that has not been deployed as widely as it could have been, but perhaps that's something that will be ready if this ever arises again.
I see. That's rather interesting, and it's a question that I know was thrown around a lot in the early days of the pandemic, and even now as more and more people went into modeling. There's another burning question that our audience wants to know about, which is whether we can add humans and human decision making into these strictly mathematical models. Like,
yes,
can the human cost be calculated or factored in somehow?
Yeah, in fact, I think that's so fundamental. So a lot of my research these days is focused on human AI interaction and how to take the best from everyone. And what are the better design patterns? Should a human provide data to a machine that makes the final decision, or should it be the opposite? Should there be other interaction patterns? And in different settings and different cognitive constraints when models and humans, there's different things that emerge. But I think more fundamentally, I think whenever we do engineering theory, it is with the goal of improving human well-being and human health and human happiness as that goal. And so I think when we think about what are the utility functions that we're optimizing for, I think most of us do try to take that into account. It can be difficult, and especially in settings where we don't have as much information about everyone's desires, it can be, again, very difficult. But that's why it's good to have kind of democratic institutions that allow us to kind of obtain information from everyone to understand what is desired. So I think bringing together ideas from kind of social choice and kind of human-computer interaction to be able to allow humans and AIs to work together to really push forward engineering design is the most powerful thing we can do going forward.
I see. It's also sort of comforting to know that human costs are being factored into these models, and really interesting to know how. I would just like to point out that post this session, we will be having a small interactive closed door session with Professor Varshney. The link for that will be put in by our moderators in the chat. But before we proceed to that, I'll ask you one last question that our audience is asking here. And the member says that you mentioned pool testing methods work for sparse levels of infection. Do you think that's something that we are at now and something that can be used right now?
Yeah, I think in the United States, like in the community where I live in Urbana-Champaign in Illinois, the rates are sufficiently low that pool testing could be effective. In certain other parts of the country, I think the rates have gotten too high, and then individual testing is more effective. And that's kind of the general setting I mean, throughout the world, right? Some regions are below the threshold and some are above. So I think it's to be seen what might be most efficient.
I see. Uh, Thank you so much, Dr. Varshney, for spending time with us and giving us this fascinating talk.
So thanks, everyone. And yeah, it was fun speaking with you, and yeah, great to interact.